Good evening, everyone, and good afternoon at South Africa. Um, Good afternoon, ladies and gentlemen. Welcome to the Rising Maternal Mental Health webinar by General Mental Health Peer Network. I'm Yana, your host and moderator for today. I also would like to greet the CEO of General Mental Health Peer Network, Ms. Charlene Sungkel, and also our beloved friends, Zach Marta, and our amazing speakers from Kenya, Claire Waithira Kyalo, Dr. Chrisna Mayangsari, Psychiatrist, and Luthfia Nur Adisti from Indonesia, and of course, all our beloved participants. Okay, friends, before we start, I would like to tell you that World Maternal Mental Health Day draw attention to essential mental health concerns for mothers and family. Life changes around pregnancy make women more vulnerable to mental illness. The negative cycle of poverty and mental illness impact on a woman's ability to function and thrive. This may also directly affect her babies with long-lasting physical, cognitive, and emotional outcomes. Mental health providers the necessary support to empower women to identify resources and personal capabilities. This can enhance their resilience to difficult the circumstances and support them to nurture their children optimally. Caring for mothers is a positive intervention for long-term social development. And worldwide, as many as 1 in 5 women experience some types of perinatal mood and anxiety disorders or perinatal mood anxiety disorder (PMAD) that we will learn more with Dr. Chrisna, psychiatrist, and statistically vary by country, but this is a worldwide concern. Perinatal mood anxiety disorder include perinatal depression, perinatal anxiety, perinatal obsessive compulsive disorder, bipolar, and postpartum psychosis. And like our tagline, no health without mental health. And increasing awareness will drive social change with a goal toward improving the quality care for women and all type of perinatal mood anxiety disorder and reducing the stigma of maternal mental health illness. And now we are encouraging mental health professional friends and relatives of new mothers to ask her how is she really feeling and encourage her to seek for help. And this webinar today is focused on listening to women's stories, experience of maternal mental health directly through their own voices. Together, now we will learn from Claire from Kenya, Luthfia Nur Adisti from Indonesia, from their wisdom and precious experience, how they overcome this difficult part of motherhood. In the last session, we will study with Dr. Chrisna, psychiatrist, about what perinatal anxiety disorders are and their definition of symptoms and their medical treatment. Okay, ladies and gentlemen, may I have your attention, please? Because our session is about to begin, and please have a nice day. Thank you. At the first session, I would like to invite Luthfia and Adisti. Hello, Luthfia, or we would like to call Bima. Hello, Bima, are you here?
Hello, everyone. Hello,
Bima.
Anna.
Yeah, I'm so happy to meet you today. And before you sharing your wonderful stories about your struggling in maternal mental health, I would like to introduce you to our participants.
Yes.
Okay, let me share your CV first. Okay. Wait a minute. So, wait, I think there is trouble here. Okay, can you see my screen? And this is our wonderful first speaker, Luthfia Nur Adisti, or we actually call her Mima in Indonesia. So Mima is a private employee in Indonesia, and she has one children. She is a private employee, and Mima is a best friend of mothers in MotherHope Indonesia, because Mima often give or provide emotional support for pregnant and postpartum women, and become a very wonderful volunteers in MotherHope Indonesia. And also Mima has often sharing her story in social media or in Instagram. Hello Mima.
Hello,
Mima,
everyone.
yeah, before we start, I would like you to know that this is a safe place for you to share your story. And please only share what makes you comfortable. And if you uh, remember something that trigger you, please don't share to us. Just share everything that makes you comfortable, Mima. Okay, Mima, your time is about 15 until 20 minutes. Time is yours. Please sharing about your struggle and your experience, how you heal from postpartum depression. Okay, Mima, time is yours.
Thank you, Miss Yana. Hello, everyone. How are you guys? This is
Hi,
Luthfia
Mima.
from MotherHope Indonesia, and everyone can call me Mima because a nickname for my son and my family. So you guys also can call me Mima as well. Yeah, first of all, I would like to thank MotherHope Indonesia, World Maternal Mental Health, Global Mental Health Peer Network, and my fellow audience here, my friends, Mrs. Yana, Miss Claire, Zach, and Dr. Chrisna, and everyone here. Thank you for this amazing opportunity for me. Thanks for having me as well. I'm so happy and very excited to be able to join this session. And I can't wait to share my experience about my postpartum depression. And like Mrs. Yana said, I often to support women and mothers in MotherHope Indonesia, and I always share my feeling and my thoughts in social media as well to empowerment mothers, especially my close friend, my circle, my family as well, my community to raising awareness about the maternal mental health. Yeah, I would be able to share about my experience. Was my experience was very tough, very intense, very challenging as well. At the same time, uh, the most difficult journey, I think, because I never imagined, I never thought that I would experience such a thing, and I was diagnosed the postpartum depression because I just feel I'm totally fine until my baby was born. My baby was born in October 17, 2018, and 6 months later, I just have brave enough to visit the psychologist because there was something wrong with me. Because what happened to me, what happened after the baby was born, I'm not happy person like before the baby was born. And I thought, I just feel very sad at those time. I just feel tired, I just feel disappointed of myself. I just feel uh, very angry at the same time, being a new mom, taking care of my baby. I should be happy for the baby that I was waiting for 9 months, but I'm not. I saw the baby start to crying, scream at midnight, couldn't sleep, and I just feel what happened to me. I just feeling sad. I supposed to be happy for the baby, but I never felt uh the happy moment at that time. And until my family and my husband realized that there was something wrong with me, and I thought my nurse who taking care of me since my pregnancy journey and taking care of my son as well, because at those time I couldn't sleep very well, I couldn't eat very well, I couldn't take a shower, I couldn't talk like usual. And I told my husband, how do you do all the things like normal? But I'm not. I just want to lie in my bed, and my tears always falling down after I saw the baby. What's wrong with me? And yeah, I taught my nurse, and she gave the advice to me for the visit the psychologist. But at those time, I don't have any chance to take some rest longer in my home, because I was not and I'm not have the position at my work at this time. I'm not settled. I just part-time employee when I was giving birth. So I off to work 2 weeks before I giving birth to my baby, and back to work 2 weeks after giving birth my baby. So I just feel lonely. I'm alone. I just feel tired at those times, and my parents still working on and my parents still working and taking care our small business at those times. So my baby and I were home alone, literally just two of us. I I I forgot to eat something. I forgot to drink something. I just hear he's crying and he doesn't want to milk from my direct breastfeeding. I just give up. I don't have any energy to push myself to you have to feeding your baby, but I don't have energy to give him milk, give him some make him calm, make him relax. I just feel I'm dying at this time. I need some help, but I'm not realized that I had postpartum depression, because uh, I still denial that I'm totally fine at this time. I'm fine, but I have to visit the psychologist. 6 months later, I visited the psychologist, and I had many questions from her. I had the assessment as well, and she told me that I had the postpartum depression. If I'm not take it seriously, it's getting worse. It's killing me softly. So I had visit the psychiatrist and take the medicine as well, and she also taught me that I had the PTSD, and the impact for the PPD. Until right now, I had the mild depressive disorder. Because of it, I had time that I couldn't be able to come to workplace almost a month. I had a typhoid fever at this time. I couldn't be able to running my daily routine because of the baby. I thought that the baby is supposed to be make me happy as mom, as a young mom, as a new mom. But yeah, the difficult time, uh, that I have faced it alone, before my family and my other people at my home realized that I had the postpartum depression. So talking about the mental health, this moment, we have to face it, the mental health and the mental health is real, and we won't be able to face it alone. We need the family support. We need the validation from the other support community and the professional treatment. Yeah, I think that help that makes me feel better is comes from my baby as well. My baby gives me big scar being a mom, but my baby also the medicine to heal my mental health that the experience was. So I think the everyone, mothers, women of their friends, family, should be raising awareness about the mental health. The mental health is real. Before I joined this community, the MotherHope Indonesia, I thought, and I looking for the article that how could be mothers and all of mothers out there could be able harm and kill the baby. And I had that time that looking for in the internet, I looking for the how to kill the baby, how to kill my baby safely, painless. And my feelings and thoughts at that time that I'm going to suicide first, and feeling tired, feeling disappointed of myself, feeling sad, feeling regret to being a mom. And I think I'm the only unhappy person in this world. So yeah, and until right now, I'm still suffering. I'm still suffering of the maternal mental health, the postpartum depression. And I take the medicine from the doctor. I take medicine from the psychiatrist, and I also still consultation from the psychologist, from the community, from the professional, because I still suffering the postpartum depression. It's been 5 years since I was giving birth, but I still suffering. So I'm still struggling. So we have to face it the mental health together. We can heal mental health together. We can help all mothers, all women together. Yeah, we need support from each other. We have to support each other to take it this mental health seriously. And yeah, that was my story. That was my experience, Miss Yana. Everyone.
Thank you so much, Lima. Your story, your braveness is very warm my heart, and I really thank you for from deep in my heart for sharing your story. I knew this is not pleasant story. I knew it is painful, and you have very strong and brave to share your story being a mother. And I noticed something that it is very difficult. The life changes from like a single woman, and then you have a pregnancy, and also postpartum, and also changes in becoming a career woman. You working outside the house, and now you become a stay-at-home mom. So I think this is very difficult changes that women need to accept. But I'm really touched by your story, and then how you help everyone's in Indonesia, how you help every mothers in Indonesia. I think you like a butterfly. You know the butterfly. You have a very wonderful journey to become a very strong mother. And thank you, Mima. And we are jump into the next speaker. And everyone's thank you, Mima, and welcome, and everyone, new participants, welcome to our webinar, and please have a nice seat. And if you have a question or you want to ask Mima something about her journey, please hold on your question because we are going to jump into our second speakers. Hello, Claire, are you there? Hi, Claire.
Hi, yes, here. How are you?
Yeah, how are you, Claire? I'm fine. Okay, Claire. Before you hear your story, I would like to your CV first.
Okay.
Okay. Okay, Claire Waithira Kyalo is a mental health and human rights consultant and educator with life experience. Claire's unique background in human rights, development, and social justice from the Institute of Social Studies, the please correct me if I'm wrong in reading, an international diploma in mental health law and human rights, or WHO, Indian Law Society, gives her a deep understanding of human rights-based approach and inclusions, mental health inclusions, and human rights. Advisory is her forte. Claire also trains on how to safeguard mental health at the workplace, NGO, church, and CBOS. Okay, Claire, I'm very impressed and grateful for all your hard work and dedication and mental health. I'm very honored to speak with you, Claire. How are you, Claire?
I'm doing well. It's an honor to be here as well. And thank you for that powerful story. Luthfia, sorry. Is that how I should say it?
Yes.
Yes. It was a powerful story. Thank you for sharing. And I'm glad to be here today.
Thank you, Claire. Claire, before you start, this is a safe space for you to share your story. And please share only what makes you comfortable. Okay, time is yours, Claire, about 15 until 20 minutes. Thank you, Claire. Please, time is yours.
So, my name is Claire, and Kyalo, and I come from Kenya, which is in East Africa. Neighboring countries are Tanzania, Uganda. Yeah. So this is it's a great honor to be able to speak today. Very intimate part of our lives as mothers, where we give birth normally isn't spoken about much. So I'm so happy that we have this opportunity to discuss maternal mental health. So by profession, my background is in mental health development and human rights. And so with that background, I also have lived experience as well with depression and anxiety. And so this began before any maternal mental health challenge. I was already living with depression and anxiety before giving birth to my child. So I already had some experience with it. So I also run an initiative called the Heart of Humanity Foundation. And we basically do projects around peer support and mental health literacy training for teachers in schools, so that as they are dealing with students, they are able to learn or pick out when there's a genuine struggle with students. And so we raise that kind of awareness and signs, what to look for in in terms of our mental health in children and children to adolescents. So I also do research and consulting work for mental health and human rights. And I'm also part of the Global Mental Health Peer Network. And it's so great to be part of this discussion today. So I began depression, and I faced depression and anxiety since I was I believe about 16 years old. So I understood what it was to live with depression and anxiety, how to manage. That is when I first experienced depression and anxiety. And the background was due to some childhood trauma and growing up in a situation that wasn't as palatable emotionally and in other ways. So by 16, I had depression. I began dealing rather with depression and struggling with that. I got some medication and, continued with school, managed to finish and continue with school. So after that, I began, after finishing with school, I began to obviously look for work. And soon after that, I got married, and then, got married. And then 2 years later, I was expecting a baby. And being married in itself and then expecting a baby, those are two different adjustments. So there was the initial adjustment and the adjustment of expecting a baby. So it came with a lot of joy and also a lot of anxiety as to how I was going to make it through. When I began struggling with thoughts and feelings before I even got pregnant. So this I already understood. And so when I got pregnant, I realized, or rather when I knew I was expecting, I reduced my medications to allow for a safe environment for the baby, not too toxic for the baby's growth. So after that, I was doing well until I got to 7 months. 7 months, and I realized, before 7 months, I realized that I was going to have not only one baby, but 2 babies. And so this is when I was overjoyed. And shortly after that, at 7 weeks, it's about 7 months, rather 28 weeks, I realized that there was an issue and I had to be rushed into emergency room and everything, and get emergency surgery. So one baby made it, the other one did not. And so as I was giving birth, I was dealing with both joy and grief at the same time. Like, yay, I'm happy that my baby's here, but at the same time, I am also grieving that the other one did not make it. So it was happy, sad kind of situation. So that was 7 years ago. My daughter turns 7 next weekend. And so I remember very intently that since my daughter was born at 28 weeks, she was premature and had to stay in the hospital for about 2 months. So after 2 months, when we were only allowed to be discharged, we were only allowed to get out of the hospital and get discharged at 2 kg. So she weighed barely, I guess, like a bag of sugar, 2 kgs, and we went home when we were 2 kgs. So it was a lot of work. But even before that, I had to leave her in the hospital so that to avoid too much incurring of bills. And also I was well, and she's the only one who needed to be there. But before I could do that, I needed somebody to speak to me because I felt that I was being selfish by leaving the hospital and leaving her there in the neonatal intensive care unit. So somebody had to talk to me a couple of times, an auntie and a doctor, and I eventually left. And then finally baby came home after 2 months. And we had a very difficult time settling. I literally had to set up a nursery at home that was almost like a hospital. So it was I was anxious about everything, anxious about how anybody dealt with the baby, how they fed the baby, how they held the baby. I was permanently basically saying to myself that it's my duty to keep this baby alive. And another thing that I want to say is that my baby was also grieving. And people most times think that children cannot process those emotions, but my baby was also grieving. And so she cried a lot, a whole lot. She cried a lot. And I was constantly, obviously the crying can be irritating, but it was normal crying with a new child, but also a child who's grieving at the same time. So this I realized later, and but everybody remembers that this child cried a lot. And so this I realized later, and I guess at the right time, it's something that we will talk about, but children know when there's loss. I guess this is why I say that children know, they feel it at fetal level. And the separation from a bond, she had to be separated from the other baby, and also having to come out too early. So anyway, yeah, so that's that. So we get home, I'm irritable, obviously angry, because no one can get things right. It has to be perfect or the baby will die. So I was a very temperamental person to be around. And most of the time I was, I even ended up shouting. I was tired. So at some point I had to make a decision, because I was doing okay, but not really okay. It was a lot to handle. At some point, I was breastfeeding, and I chose to breastfeed, but at some point I had to make a decision to stop breastfeeding in order to get medication that is sufficient to address the depression and anxiety to keep me stable. Because I was sacrificing my health for the baby. I was like, no, I need you to breastfeed. So I'm just staying on the minimal medication so that it doesn't cross over the barrier into your system. But it was a very difficult decision to say, okay, I can't breastfeed anymore. I also need to be healthy. So I stepped back. Very, very difficult. Other people had to feed her because obviously I was still producing milk, but eventually it went away. But that was a difficult decision, I can say. And in terms of support, I can say that I did. Let me answer the question. Did I eat and sleep well? I ate well, but I slept too much. I was constantly tired. I would wake up, and every day my husband reminds me, I'd wake up and I'd wake up crying every day for about almost a year and a half, almost going to 2 years. Every day, wake up crying. And yeah, so those were some of the emotions I can say I was feeling. And I tried to cope by having more support at home. I had two ladies to help me. In Kenya, we call them, it's like a nanny that, basically two nannies to assist me with the baby so that I could, when I wake up, I feed the baby, had to go back to sleep. I was also a baby, literally. Like I'm a mother, but I needed that kind of care. And I struggled with the mental health until I got to a point where I had to have ECTs, which is electroconvulsive therapy, which kind of was the only thing that brought me out of the depression after, I believe, 3-4 years, about 3-4 years. That is finally when none of the medication could work. And I did the ECT therapy for about 2 weeks. I was in hospital. And after that, I was back to myself. And so this process obviously needed me to be away from the baby, but I had good support. So I wasn't so worried about that. But I did like and appreciate the fact that I chose to get support as opposed to suffering alone. But it was still difficult because there's a cultural context that says you're a mother, you're a superwoman, you're an African mother, you need to do everything, you're strong when you do everything for your baby. That's the best way to give your baby everything. So realizing that I'm not a super mom, coming down and saying, okay, I have struggles, I need support, that was also a decision that I had to take, and ignore the culture that says women should do everything and to be on top of everything. I think those are the things that help me feel better. And those in terms of getting therapy as well I did a bit of therapy as well for the grief process, because by the first birthday, I was happy, but I was also grieving. Second birthday, happy, but also grieving. So every birthday came with this reminder that, okay, you're blessed to have a child, but one is also already up there. So I still say today that I have 2 children, to those who know me personally. So I believe the biggest thing that I would say was difficult to cope with was the cultural narratives about motherhood, and the fact that I also did not want to be around my baby all the time. I didn't want to be, and at times, say, my husband would come home and I'd just hand him over the baby at the door, like, I've had enough of this crying, just take over, So it was a lot, and still on medication for the depression, anxiety, but the hormonal imbalance that birth brought definitely is something to note. And so it was postpartum depression, double postpartum depression. I felt like it was, yes, I already knew I was dealing with depression, but I now had the effects of just giving birth. So I relate to and I understand that the feelings that my peer shared, Luthfia, and when she said that she was, wondering if she's feeling alone, feeling like she's dying, and when is this gonna be over? I also felt that, and I was like, when is this gonna be over? When are they gonna just take the baby away and stay somewhere else, give me some peace, And it was definitely a heavy load because I was already struggling. But fast forward 7 years later, I'm doing well with my mental health. I began some support group for mothers with premature babies and mothers also who had lost babies along the way. So that I've been able to give back in that sense. And I also completely believe in having good support to encourage better maternal mental health. And I'm much better. I know that every pregnancy is not the same, so don't know what to expect the next time. But I'm doing very well now. We have an incredible bond with my daughter, and she's better as well. She doesn't cry as much these days like she did, and it's by God's grace that we're here. So thank you so much for this time.
Thank you, Claire. What a very warm story. Thank you for your braveness, and I know it's not easy for you to share the story, but really very, very inspire many people and also help them to seek for help. And I agree with you, but sometimes being a mother is not only about joy and happiness. Maybe at the same time we feel that we're happy with the baby, and but sometimes we feel about the grieving about losing ourselves, and also sometimes very lonely and struggle with our motherhood. And what I very noticed from your story is how you let go the perfectionism as a mother, and I think this you are very strong mother because you let go the perfection or idealism about breastfeeding and how choose your mental health. And I think every woman in this world is agree that becoming a breastfeeding or bottle feeding is not make you a good mother. Every mother has their own choice, and it's not make you a good mother breastfeeding or bottle feeding. And your struggle, how you your journey, how you heal from your postpartum depression using medications and consultation and ECT therapy, and it's very you are very strong woman, and I'm very proud of you, and I think everyone
Thank
here
you.
is very proud of you, how you heal and how you struggle with that day by day until you get back to yourself again. Thank you,
Thank
Claire.
you.
And I think everyone wants to ask you questions and Mima. And but wait a minute, because we still have our last speaker and Dr. Chrisna. Hello, Dr. Chrisna.
Hello, Miss Yana, Mima, Claire, and everyone here.
Hi, Dr. Chrisna. We are very happy to have you here.
Hi, doctor.
And
Hi.
our
Likewise. Yeah, I'm also happy and grateful to be here. Thanks for the invitation.
yeah. Okay, Dr. Chrisna is an expert in maternal mental health psychiatrist in Indonesia, and also Dr. Chrisna has support psychoeducation group and support group, and also trained health workers in Indonesia. Okay, doctor, before we start your presentation, I would like to introduce yourself to our participants. Okay, Dr. Chrisna Mayangsari, psychiatrist, is a certified psychiatrist with over 5 years of experience and focus in psychoeducation in health talk, seminar, and online class. Dr. Chrisna work experience in clinical supervisors and also head of psychiatrist clinic in Bekasi Hospital. And also Dr. Chrisna education. Dr. Chrisna has graduate from Maranatha University for medical doctor, and also Dr. Chrisna become a psychiatrist from University of Indonesia graduate. And Dr. Chrisna has a lot of publications like distress related to anxiety depression symptom Indonesia Journal of Psychiatrist and Mental Health in 2016. And also, Dr. Chrisna is a member of Indonesian Doctor Associations and member of Indonesian Psychiatrist Associations, and also the co-chair of Publicity Global Alliance of Mental Health Advocates, Internal Commission of Community Psychiatrist Section, and Indonesian Early Careers Psychiatrist Community Service Commissions. And Dr. Chrisna has received a lot of awards, like the best 10 poster awards in World Psychiatrist Association Congress on 2017 in Berlin, and also the third winner of Young Research Award in Community Psychiatrist National Congress. And also Dr. Chrisna has becoming a lot of speakers in seminar or webinar, like in Instagram, and like speakers in online health and many platforms. Wow, very wonderful, Dr. Chrisna. Okay, we are very happy to have you here. And Dr. Chrisna have a recording before we start our discussions. Okay, let me play the recording first.
Married life is fun, but also challenging, especially married life is fun, but also challenging, especially when expecting and having children. The data shows that 1 in 5 women and 1 in 10 men, surprisingly, experiencing perinatal mental health problems. Therefore, I'm Chrisna Mayangsari, psychiatrist from Jakarta, Indonesia, will give brief presentation about maternal mental health that consider as a major public health challenge. And now, I would like to invite all participants here by answering the following statement. Depression is the only maternal mental health disorder. You can type yes if you are agree or no if you are disagree in the chat column. Okay, stop. And thank you for answering the question. The answer is no, since there are other conditions such as anxiety and psychosis, which will be discussed later. We know about the concept that mental health is complex, and all women can develop mental disorders during pregnancy and in the first year after delivery. But these factors from biological, genetic, psychological, such as personality traits, and major life events generally increase risk for the maternal mental health problems and disorders. One of the maternal mental health problems which happens very often is baby blues syndrome. Up to 80% will experience this after giving birth, tied to sudden shifts in hormones. Women who experience may feel sad, having crying episodes and mood swings. The blues are not considered as a disorder because the symptoms often resolve within few days. If symptoms persist beyond 2 weeks, it is likely that the mother is suffering from depression. The depression during pregnancy until 1 year after delivery occurs in 20% women, with the symptoms vary from mild to severe. We have the main symptoms of depression: sadness or depressed mood, anhedonia, or difficulty finding joy in activities once enjoyed, low energy and motivation, following by other symptoms such as trouble concentrating, having physical problem in appetite and also sleep pattern, feeling guilty, hopeless, and in severe condition, the mother have suicide ideation, even attempt to suicide led to death. And up to 15% women will develop anxiety during pregnancy or after childbirth. Symptoms often include extreme worry about what ifs, like what if my baby falls? What if my baby will have anxiety or Down syndrome? And also about the insufficiency. So the mother extreme worry about not being a good mother or being able to provide for the family. And also the problem in cognitive and physical as well. We also know about OCD and birth-related PTSD can happen as maternal mental health disorders. The last disorder that we will discuss is perinatal psychosis. Even it is a rare condition and occurs in about 2 in 1,000 deliveries, this considered about the medical emergency due to the potential harm for the mom to harm the self and also to the baby due to the symptoms such as auditory hallucinations and persecutory delusions. And what the impact, not also for the mother, but also for the baby and families, also other communities. The mother suffers a lot and may fail to adequately eat, bath, and care for herself. This may increase the risk of illness. The risk of suicide also a consideration, and in a psychotic condition, the risk of infanticide must be taken into consideration. Very young infants can be affected by the mother condition as well. Prolonged or severe mental disorders hamper the mother-infant attachment or bonding, breastfeeding, and infant care. And what to do? The good news that this condition is treatable. So maternal mental health can be integrated into general health care, including women's health, maternal and child health care, reproductive health care, and also other relevant services. The important about collaboration and support from the partner or husband, family, friends, community, and other sectors, government or non-government. And it is important to prevent and treat the maternal mental health problems and disorders. Last but not least, we will celebrate International Mother's Day on 14 May, so please say thank you and grateful to all wonderful mothers in the world.
Thank you, Dr. Chrisna. Please give applause to Dr. Chrisna presentations. Thank you for your wonderful presentation, Dr. Chrisna. Dr. Chrisna, maybe you want to add something before we jump on the Q&A these sessions.
Yeah, thank you very much, Ms. Jana, and for the participants here and also other speakers. I would like to edit that we are women. We are strong, but also not only about the strength, but we are still human, and human we still have the weakness, but everything we are beautiful. And so why I also record, yeah, because I made the preparation. Now I am a new mom and I have 4 months baby. While we are in the Zoom meeting right now, the baby is crying because she wants to have the milk, and I am breastfeeding right now. So we can do everything at the same time. So please do not hesitate for all participants here to discuss and maybe to collaborate in the next event. Thank you so much.
Thank you, Dr. Chrisna. Okay, friends and participants, now is our Q&A and discussion. Please, this is your time to ask to Mima, Claire, and Dr. Chrisna about anything, or maybe you have yourself experience in motherhood. Please, you can ask by open your microphone or write on the chat box, please. Or maybe if you want to directly asking with the speakers, please raise your hand first. Okay, I think I will read in the chat box first. Okay. Yeah, everyone said thank you for sharing your story. It was very powerful, beautiful, inspiring. And this is question from Tika from Indonesia. I think it is for all participants. Hello, my name is Tika, and how do we provide understanding to our families or friends who experience maternal mental health problems? Because there are still many who consider the problem is a disgrace or stigmatizing, give a stigma for everyone or every mother who have mood disorders. Okay, how do we provide understanding to our families? How we tell about our condition, mental health condition, to our families or friends? Okay, thank you, Tika, for a question. I think, Mima, would you like to answer the question first?
Yeah, thanks for the great question. I'm trying to answer in my opinion. My parents were still not understand about the mental health, but they were watching me at home. They were watching my behavior at home. They were watching my behavior to my baby. And I explained clearly and slowly, day by day, week by week, and they were realized that there was something wrong with me. At that time, when I was 2 weeks at home, my dad touched my body, and my body was getting cold every night. And my dad asked me, what happened to you? And my dad directly taking me into the emergency in hospital. And after I was arrived in hospital, I told the nurse, I told the doctor, because I was giving birth and the symptoms like this every night comes suddenly. And my parents realized that I have something unusual. And until the day my parents say sorry to me, because at those time they didn't have a chance to taking care of me because they were busy on their working and taking care of our small business family. And my mom said, we are very sorry, we're not noticed about your condition. And yeah, and after they were watching my physical getting weight, and I'm getting sick easily, a month, and couldn't be able to work, couldn't be able to running my daily routine. They finally understand that the mental health is real. My daughter is sick, and my mom is realized as well that because my mom is working on social as well, that she was taking care of other women and child in my environment, and she was understand finally. So maybe maybe in my experience was that they were watching us at home behavior, and they were finally understand that mental health is exists, is real.
Thank you, Mima. Yeah, it's very difficult to make an understanding for families, but you can do it. And thank you for sharing your perspective and experience. And how about you, Claire? How you give an understanding for your families and your relative about your condition at that time?
Thank you so much for your question. Hope you can hear me well. How did I explain to my family about the situation? What I did was I involved my husband in when I went to visit, and also when I went to see the psychiatrist. So he was aware, but I must also say, I feel like there was not enough support for him as a man. So I was getting a lot of support, but he wasn't getting enough support. So later we had to agree that probably it was, he was being encouraged to be strong. So he was not allowed to feel the loss with me or process it. It was like, be strong for her. But in that way, by bringing him into the appointments and having him there, he understood, and he was my main support system. The other, the help at home also. At some point, I opened up about what I was going through to the lady who was helping me take care of the baby personally, and she got to understand that. So yeah, I think it was about speaking. Just speaking, and speaking to be understood, and also sharing resources with my family members about it, so they could understand what it was. So yes, this is how I garnered a lot of support from family front.
Thank you, Claire. I think sharing vulnerability is very difficult, and sharing vulnerability is also a part of your strength and how you to be honest with your family. It is very important to us. Thank you, Claire. And we would like to know from Dr. Chrisna, maybe what is the better way to tell about our psychological condition after giving birth, that we have symptoms of mental health disorders for our family, because I think it is more difficult if we have an educated family, or maybe a family who live in uh, very stigmatizing traditions, or maybe in a very not good environments, not supported environment, or maybe like we call like unsupported family. How we tell our condition, how to be assertive about our feeling, how about our thoughts when becoming a mother is very difficult. Please, Dr. Krista.
Yeah, thank you, Ms. Yana, and thank you for Tika for asking this important thing that we must know about being a mother. It is not an easy job, and I agree what Mima and also Claire say about recognizing about signs and symptoms, and also involving the family members or especially the partner to become a team, great team for overcome about what is happening. It is important, but also for the other members who are uneducated, I agree about bring them to the primary health care or involve them in the clinic or in the hospital and discuss with the doctor, because somehow if they have the education in a simple way, they can more understanding, yeah, and also to see what we experience in daily life. They can know about this is not about what we want, but this is the symptoms who makes our daily living become impairing. And also the education, especially in the stigmatized and poverty environment, something like that, we can try in a simple way, yeah? Because let's say that thing about the mother who has experienced the depression, the family or the neighbor said about maybe this is because of the black magic, something like that, related to the cultural. But right now, if they give the we give the information about what is the what is the cause in the hormonal or in the chemical imbalance, something happens in the mind, in the brain, hopefully they can understand about why we go to see the doctor or psychiatrist, because the problem it is about the health. In this, about the brain, and also the psychological or also the environmental or traumatic life events. Hopefully this can also answer Tika question.
Thank you, Dr. Krishna. So the key is to involve the family members to go with us to consultation in primary health care. Okay. Thank you, Dr. Krishna. Maybe do you have another question, participants here? Maybe you would like to share about your experience and sharing with us about your motherhood journey. Please your right hand, or maybe you can write it on a chat box and we will write on. There is a participant from Indonesia. She is Agustina Wanisari Rahutami, or we usually call Ami. Hello, Ami. Are you there?
Halo Mbak Yana.
Halo Mbak Ami. Would you like to share with us, or maybe you have questions for our beloved speakers? Please, time is yours.
Hello, good night everyone. Thank you for the opportunity. Give me a chance to share my uh, I am the bipolar survivor for this 3 years from the doctor diagnosed me with bipolar. But before the 6 years ago, the doctor was diagnosed me with postpartum depression. So at the time, the first time I feel like there is something wrong about me, about myself, when after I give birth to my second born. I feel like that I don't know what I'm feeling, like there is something something different about myself, and then I and the what it's called, like I have the like psychotic, like the sound, like the sound in my mind that like that asked me to commit suicide with my baby at that time. And then at that time I feel like I need the help. I need the help. And then after that, my husband was support me and realized that there's that I need help. And then I with my husband find the information, what happened to me, what's going on with me. And then we found that there is the community, MotherHope Indonesia. At that time, I found it in the Facebook group, and then I joined the community, and I get to know the Miss Nur Yanayirah, and then after that we have the support group, and Mrs. Nur Yanayirah asked me to come to go to the support group with my husband also, and then we sharing in that support group, we sharing. And at that time I feel like that I'm not alone, like there is another mother that feel the same with me. And then Mrs. Nur Yanayirah and the psychologist make me go to the psychiatrist after that. And then I go to my psychiatrist, and at that time the second time I go to my psychiatrist, and then I have my diagnosis as postpartum depression. And I feel like that the support system that I have, like the community and my husband, helped me a lot, and that's they saved my life. And I feel like that I feel like I feel like thankful to my choice at that time to go for help, ask my husband first, and then find the right community that when I can share my problem. And then I found the right community. That's the important thing for the mother, for mom, after giving birth and then have such a problem like me, that get the right and support system. That's so important to me. and saved my life. And then after that, from that time, I decide to, when I see Mrs. Nur Yanayirah, see, so I'm so proud of her and the integrity that she have, make me want to help the other moms too that have the problem like me. That we are not alone in our community. We are together, give support, caring each other, and that's the important thing, and that's that I'm grateful right now. Thank you. Thank you.
Yeah, thank you so much, Ami, for sharing your story. We love you so much, and yeah, Ami has becoming a member or volunteers on our sisters, of course, our old sisters, from 2016, 7 years. Ami has encouraged a lot of women in Indonesia, in MotherHope Indonesia, pregnant and postpartum women. And also Ami has become a best friend for every mothers, and very honest, very true to sharing your feeling and becoming a safe place for every mother who struggle like us. And you are very precious, and we also proud of you, and I'm very proud of you. Thank you for becoming our sisters in this journey. Thank you so much, Ami. Or maybe Claire or Dr. Chrisna or Bima, would you like to give an encourage statement maybe for Ami?
Well, thank you so much, Amy, for sharing with us about your story and the power of social media or technology. Nowadays, it can also attract one to another, and it can reach out, yeah, like a program to reach out and to invite other people join in the community, such as MotherHope Indonesia. And I'm really proud about Miss Yana and her works, also all co-workers who dedicate all their life in the community for women, support women. And it is really important that we can help each other, and also we are supporting not only for ourselves but also to others. It's a blessing to have the community in nowadays with the technology or the social media. Thank you.
Thank you, Dr. Krishna, from your warm words.
Yes.
Maybe Claire or Mima?
I just want to add that well done, and thank you so much for sharing. I just want to say that there's no experience that is wasted. This is what I always remind myself. What you went through will allow you to help, will continue to allow you to help other mothers, just like you going through the same struggle. So I just want to encourage us all that there's no experience that is wasted in life, including mental health struggles. Thank you.
Thank you, Claire. Ima, before we jump in our closing, yeah.
I just add a little bit why we have to share or spread love on the social media, because we don't know how the condition of other women, others mother out there. So we have to empowerment or women or mothers, our friends, our family, our relative, our colleagues. The social media is very useful to spread the love, spread sharing knowledge, sharing experience, so we can connect with each other, we can heal together. We won't be able to face it, the mental health alone. We need the very full support system like this time, this amazing moment. Thanks for sharing, Mbak Ami. And we are together to get through it and heal together for all mothers and all women and everyone in this world. Thank you.
Thank you, Mima. Okay, everyone, because time is almost finished, but before we closing and have a documentations, I would like to please to our speakers, maybe from Dr. Chrisna first, and Claire and Mima. Is there anything else you like to share with us? Maybe like an important, your most important message for every woman, because not only from Indonesia or from Kenya, I think everyone, every mothers in this world from every countries would like to watch this webinar. Please share your key message, key message or your important message to women around the world. What is the important things that you want to share that about maternal mental health? Please share with us. Thank you. Maybe from Dr. Chrisna or maybe from Claire first. Okay, maybe from Dr. Chrisna.
Okay. Well, thank you. My key message for all of us here, especially women who already become the mother or maybe who will be the mother. We have the choice in our life, and what we done right now is the first step, let's say, or the first gate to go to the next journey, which is very important, to increasing the awareness of mental health, especially maternal or women's mental health. And because as a strong or healthy mother, we can also bonding with our children and make the healthy generations. And with the healthy generations, it can also support the healthy or improving the wellness in our country. So from the small become medium or to big, in the world, the impact. And also do not hesitate if you experience or struggling with the symptoms, or even you are in the problems or even disorder, to reach out for help. And you are not alone. If you cannot see about the help, just sharing this first to the person, one person that you are, let's say, comfortable to share with. And if you don't have, please go to the professional, such as the mental health professionals, psychologists or psychiatrists, even the medical doctor in your country, in your city, or in your area. And hopefully from the step that you take the part, it can also help not only you, but also impact to your baby and the husband, and also the families and community. Thank you so much.
Thank you, Dr. Chrisna. Okay, Claire, please share your key message.
Thank you so much to Dr. Chrisna, Luthfia, and Yana also for having me here, and everyone who's here today. Mothers or mothers to be, I guess I just want to say that the most important thing for me, and what I remind myself often, is that I'm enough. I'm enough, and that means that the strength that I have is sufficient, and it will get me through it. And especially where I have any struggles, I know that support is and help is just, well, a step away, because definitely in different social economic contexts, getting support for mental health, maternal mental health is expensive. But I would also say it's an investment in your health as a mother, is an investment in your family. And as the doctor said, it's an investment in generations, because at the end of the day, whether I had milk or not, my child needed a sober individual to make decisions about this, how the formula is going to be given, how it's going to be mixed. how, she needed a sober, not sober, she needed a mentally strong mother more than even the breast milk that I always felt sad about, having to not be able to do that as part of our bonding. However, I also did things like the kangarooing, which helped, which is putting the baby right next to your chest and covering them. So we did that a lot, and it made up for that bond. So yeah, an investment in our health as mothers is an investment in our families. It's the best we can do for them. And let's also remember the supporters around us and the caregivers, and take care that they also don't get overly exhausted. So a continuous support system that works as a team is really good. Last thing is culture. Let culture not hate our health as mothers. What you can't do, get help. It's okay, and it's the best decision to make as a mother. Thank you.
Thank you so much, Claire, for your warm statements. Next we jump to Bima, our last speaker. Please give your key message.
Yeah, maybe we were lost our self-identity because of the mental health itself, but we were not lost, or we don't lose our hope for our future, hope for our children, hope for heal the world, and we can go through it together. And the support system is very useful, and we need the good support system, especially and especially family first, and then community first, and then professional. So yeah, and we are not alone. We have each other. We have everything we need, like this station. So we don't lose hope because of the mental health.
Thank you, Mima. Thank you, everyone. Dr. Chrisna and Claire. And right, I'm very agree that the key message is you are not alone. You are never alone in your journey, and you are not to be blamed. It's not your fault, because it's something that's not ourselves. This is a disorder, is not ourselves. And also for everyone, please, if you find your friends, your wife, your relative, your sisters maybe, please, if you find something wrong, and please asking how she's really feeling, and please encourage her to seek for help. This is a very important key message for all speakers in webinar today. And I also want to say thank you to all participants. Thank you for our participants from Kenya, from South Africa, from Indonesia, maybe from another country. Thank you for joining us, and thank you for listening for our stories. And of course, thank you for Charlene, and thank you for Zach from General Mental Health Peer Network. Thank you for your opportunity to help this very wonderful webinar. Okay, Zach, maybe before we close our webinar, maybe would you like to make a photo with us? Make a documentations?
I actually took a lot of photos during the webinar, so don't worry about that.
Okay, thank you. So good evening, everyone. I hope we can make another webinar about maternal mental health. Thank you for your time. Thank you for your precious experience and your questions for our speakers. Goodbye and have a nice day.
Thank you, everyone.
Thank you.
Have a nice weekend.
Good to see
Thank
you guys.
you, Dr.
Have a blessed
Thank you.
Bye. And hi to